The truth is that I prefer to call it in lay terms as a GPS for patients. But it's a GPS with a soul, because we do it as a service. We do it as something that can help the patient to go through the difficulties from the moment that the patient is diagnosed with cancer, and for as long as they want to be members of Belong, or belongers, as we call them. So that's in essence what Belong.Life is all about. There are different groups according to different cancers that they can join. For example, there is one on breast cancer. There are two on breast cancer, actually, on early breast cancer and on advanced breast cancer. But these are professional groups. Those are with a doctor, in this case, with me. But there are other 70 doctors that they take care of other groups. And there are also breast cancer community groups, and where the patient can talk to other members of the community about their problems. We have not only doctors working, but also some allied disciplines, nutritionists, psychologists, sexologists, etc., that the patients also can voice their problems, their concerns. For example, the sexology group is a very important one. Patients don't usually like to speak to the doctor about certain things, and for sure not in front of the wife or the husband when they come to the interview. But they find it much more easy to talk about it on an anonymous chat with the doctor. And that facilitates and educates the patient also very good. Besides those things, we have informative things. We have what we call Belong News. We have Belongpedia, so the patients can look at different subjects, different what is the meaning of a specific word. Doctors, we used to talk to patients in our own words, and for the patients sometimes it's difficult to understand. So Belongpedia can help them to understand the meaning of certain medical terms. And we have now a very good and very important project and group, which is clinical trials. So we do match patients to clinical trials wherever they are in the world. And remember, this is a global initiative. We have more than 250,000 members all over the world in more than 100 countries. And therefore, sometimes it's a little bit difficult for the patients to know what are the clinical trials in their own setups, in their own country sometimes. And so they send us all the information regarding their cancers and their disease, and which is, we request that to be de-identified, and we look at that and we try to match them to an eligible clinical trial which is nearby their places. And that is, again, a free service from us. So that's all in all, that's tell you how to, what is Belong.Life. Now, this is an application that you can download from the App Store, whatever you have. If you have an iOS, Apple, or you have an Android, so it's there in your store.
Great. That sounds really connective. And so kind of with that connectivity, in this, kind of in this moment of crisis for a lot of patients with cancer, one of the things that you guys are looking to do is to run support groups
Sure.
with to help patients deal with the ramifications of COVID-19. And I was wondering if you could kind of get into how these support groups look. Is it just similar to how the rest of the app runs, where someone can anonymously come in and talk to another patient and talk to another doctor, or are they being run at certain times? How does it look, and what can patients expect from it?
Right. So it is it's run similar to the others, a professional and a community group separate. The professional group manned by a professional doctor, myself, in this case, because it's an area that I have been involved for a long time and of interest to me, which is immunosuppressive drugs and immunocompromised patients. So what we do, once again, is similar to what we do in the general population of patients. It's anonymous, it's free, it's educational, it's support, and especially extra support during this pandemic. So the most, patients, what they are looking at is that not just trying to obtain more information, but trying to obtain information which is valid for them specifically. If you go into the internet, if you if you open the TV, you will see or you will hear lots of information about the COVID-19 pandemic. But does it apply to me as an individual with cancer? Does it apply as a caregiver of a patient with cancer? Does it apply to my patients? Is this what I need to do or not to do? And sometimes patients don't see that. And that's why we are there, to give that information. Now, we try to clarify situations. We try to misspell myths and misconceptions. We try to inform patients about the preventative steps. So those are the points, the strong points of this support group. I hope that that's more or less what you wanted to hear.
Yeah.
So I can expand a little bit if you want.
Sure. Well, because I guess if you could expand maybe on what are some of the goals with the program, like what are you hoping patients are going to be taking out of it when they come to these support groups?
Yeah. So patients come, and usually they have a variety of concerns. And we were talking to Lior a few days ago, and we can define them according to two specific groups: those patients that they have self-concerns and those patients that they have social concerns. Self-concerns is how is this going to affect my treatment? Will I be delayed on my treatment? Call it surgery, call it radiation, call it chemotherapy. What are the effects of those delays on me? How rationing of care will affect me, because it's happening. We know, we read about it, we can see it, that in hospitals now there is, that rationing of care, where priorities are being given different situations. So how does it affect me? How will it affect me if I have to go to the clinic or to the cancer center or whatever, and be in contact with doctors and be in contact with medical staff? What do I do? How do I prevent? How do I manage in those circumstances? And how susceptible am I about being infected? And what does it mean? Are all cancer patients getting, COVID-19, or some cancer patients are getting COVID-19? How do we manage with that? So those are some of the self-concerns that patients have, and they express that in their posts to us. And then we have the social concerns that the same patients have because they have cancer and they have surgery, radiation, or chemotherapy, and they don't understand the degree of their immunity is at the moment. If I had cancer 5 years ago and chemotherapy thereafter, but the last 3 or 4 years I'm fine, I am at the same level of risk of immunocompromise, or the same way that other patients that they just finished chemotherapy a week ago, or they are undergoing treatment now. Those are also some of those concerns. And the more the social ones are about the contacts with patients, other patients, contacts with hospital staff, and the caregivers' concerns with how do I protect the cancer patient who I am supporting, who I am helping. All that comes through the discussions with the patients. Patients write a post. Well, first of all, they have to download the Belong.Life application, and then they go into this support group, Cancer and Corona. And there they write a post. And within a few hours, we try to do it within a few hours, never longer than 24 hours, we reply to them. And then they can reply back and tell us if that helps us or it helps them, or if it's they want something more, and we talk about it further. And they also receive further information in the group regarding certain of the things, new things that are happening, what the FDA is doing, what the CDC is doing, what is happening in other places, things to keep them more involved from a proper source and not fake news, which is sometimes a problem. Yeah.
Right. It's something that's totally rampant. And kind of just to clarify, for each of these groups, are they going to be siloed almost in terms of like the caregiver concerns, in terms of like cancer specific concerns, or like you said, something more like they're just going to hop in with their questions and then you reply case by case?
Yeah, we don't divide things. Whoever is interested in writing, if it's the caregiver or the patient or a family member, they mention that in the text, and we just reply accordingly. We don't split that according to groups or anything. It all comes under the same umbrella.
Great. So, and then maybe how can patients look to get to this group? Is it just a matter of downloading the app, or is there going to be certain timeframes they should be submitting these questions towards?
No, it's really very quick for them to download it, and once you download the app, you can choose whatever groups you want to be part of. At the beginning, patients usually choose just one group until they start seeing how the mechanics of the group works, and then they can be part of different groups. For example, if I have breast cancer, I can be part of the professional group with the doctor. I can be part of the community group with a community, and I can also be part of the sexologist or the nutritionist or the radiologist or the Cancer and Corona at this present time. And so a patient can actually be part of many different groups without any limitation. And they can do it, just by opening it in their own device. And so that's very easy from that point of view.
Great.
And we have patients that are, young and elderly and without any problems. Yeah.
Everyone's got a smartphone now.
Yes, that's right. Yeah.
And so kind of with that ease of connectivity, how are you getting professionals to come in and help answer the questions? Is this that previously work with Belong.Life, or do you reach out to professionals to help answer the question if you can't answer it yourself?
Well, if I cannot answer the question, which is rare, for sure we do have other people that can help. For example, I may be asked a question about a pediatric patient, and I'm not a pediatric oncologist, and so I refer the patient to someone with that, keeping that in mind, and so forth and so on, or a hematologist, oncologist, patients with leukemia, for example, myeloma, they may ask me a question. And I prefer that a hematologist, oncologist answers that. So I don't mind, and we don't mind as doctors working with the patients, we don't mind if a patient writes to us a question and doesn't really apply to that specific group, because sometimes patients don't know, do I belong to this group or to that group? So we also have a bigger group, which we call Ask the Oncologist. So it's a much more wider group. So there they can ask anything what they want. That doesn't stop them from being, if they have, I don't know, lung cancer, and they are in the Ask the Oncology group, they can also go and be part of the lung group and be answered by another doctor who is doing that. So they can get more than one opinion, support, recommendation. We don't treat patients. We don't recommend treatments. We just give them guidance. If a patient says, I was diagnosed with this type of cancer, what will be my treatment plan? So we said to them, okay, according to what you say, then you will need surgery, and you will need most probably radiation and maybe chemotherapy. But we don't tell them how long the radiation, how much the radiation, how many chemotherapies, what will be the treatment specifically. That's for the oncologist that is treating their patients at their institution. For us, it's just to give them that understanding, and that the patient, when goes to the appointment, then can say, oh yes, I have heard or read about this treatment and this treatment, and at least they go to an appointment with some knowledge of where they are standing.
Great. And so how many of the COVID-19 support groups specifically have you been able to run so far, and how has that been going? And if you can maybe provide a couple examples. Sure.
We started recently. Well, this is all new for everybody. We started around, now it's 10 days ago, more or less, or 11 days ago, that we started the group. We have approximately around more or less 25 patients every day asking questions. And it might not sound a lot, but believe me, it's quite a lot, because not everybody knows about the application, and we want more people to make use of the facilities. It's, the patients post the concern that they have, or the question that they have. They give us a background of their medical history, and it's replied or by me or by one of the other doctors. As I said, probably a few hours later, but not more than 24 hours. So everybody is guaranteed to receive some information, some guidance, in a matter of time, in less than 24 hours.
And with that, I don't know, is there any examples or stories you might want to share about how the group's been going, if patients are, it's still kind of early?
Yeah. I can just tell you that most of the questions is related to, what do I do in this circumstance? How do I handle myself in this circumstance? Do I visit family and friends? Do they come to visit us? Should I be taking extra precautions because I am immunocompromised? those, I know how the doctors are going to treat me. Are they going to give me the same good care than before this pandemic started, or I'm going to be, looked at the side because now they have the hands full with other things. So those are the concerns the patients have, and they are voicing them. And the caregivers, because some of the caregivers are family members and they live in with the patient, but some of them are not, and they come from outside, and how to protect themselves, and what to do when they come to see the patients. Those are the problems they also have. So from that point of view, as you can see, it's quite a different situation from just treating a cancer patient with an infection, let's say, than to treat in this scenario of a pandemic. So we try to give information. We try to make it easier for them to understand what is happening. There's so much confusion, so many news which are not helpful. And so we try to, at the end of the day, help them navigate it better.
And is there any advice that you might want to give patients yourself, as far as like what, simple guidelines they should be following?
Sure. So I think that we need to be very, very strict with ourselves and follow the health regulations. So all those authorities, health authorities, approaches or steps how to prevent this infection. So we have to be strict with that. So we are talking about the washing of the hands and the using of the different hand gels and alcohol gels and all those things. The using of masks and the using of gloves, and all those things that are already recommended by the health authorities, we stress that they are very, very important. In my personal opinion, not just that, but social distancing is a must. But because it's getting a little bit difficult, and because it's being alone and not in contact with the family, we need to try to keep our routine also. Try to do the same things that we do at home on a daily basis without going outside. Staying home, it's number one thing. Keeping the routine, it's number two thing. And keeping in touch with our social community is extremely important also. So although there is social distancing, we are living in a time that we have these capacities, internet, Zoom, and Skype, and whatever other means of being in contact with our patients, with our families and friends, and not just by videos, but just by phone and by audio. And those are the things. It's unfortunately, there is no something wow that we can tell our patients, but it's common sense, social distancing, staying home, keeping in touch. Those are important things, how to go over this difficult period of lockdowns and isolation.